thank you all for taking time out of your lunch break or your pending lunch break to join us today. My name's Roisin Sweeney and I am the Research Evaluation and Practice Lead at Injury Matters. And over the next half an hour or so, we're going to talk about just some scene setting activities to help our evaluation activities in the injury prevention sector in particular. Before we do get started, though, I would like to acknowledge the Whadjuk Noongar people as the traditional custodians of the land in which I am presenting from today, and give thanks for the privilege that it is to work and live on their beautiful country, and also pay my respects to elders past, present, and emerging from wherever you may be tuning in from around the state today. So there's lots of familiar faces online, which is great to see. But for those of you who aren't so familiar with what we do at Injury Matters, we work with people and organisations across WA to really encourage the innovative delivery of injury prevention and recovery solutions across the state. And we do this just to really try and keep our community safer at home, at work, and on the go. And our approach within this is really expansive. So we cover everything from road safety to falls to trauma recovery to substance abuse harm and capacity building activities like we are going to talk through today. And within this space, we work with lots of different sectors, so the local community themselves, industry, government bodies, private sector and emergency personnel, just to make sure everyone understands what their role is in injury prevention and recovery. So I'm sure you all fit within this remit to some degree. But in particular, today's webinar is brought to you through our No Injury program, which is provided by Injury Matters and funded by the WA Department of Health. So if you're not so familiar with this program, it is purely a capacity building program. So within the No Injury program, we provide ongoing networking activities, training and development activities, such as the webinar today, and really just to support the sector at large to continue the great work that we are doing across the state and are fortunate to be able to do here in WA. So before we jump deep dive, I guess, into the more evaluated skill side of things, for anyone that's not so familiar with injury as a public health issue, it is a huge it's a huge issue impacting our community here in WA. And as you can see on the slide, just some key stats here about the current incidence of injury in WA. And we can see that more than 4 members of our community die due to an injury-related incident every day. And the leading causes of these fatalities are falls, intentional self-harm, and transport-related incidents. So again, just demonstrating the breadth of the issue that we're trying to address as a sector. And also every year, 1 in 4 adults report requiring treatment from a health professional due to an injury, again, placing that burden on our healthcare sector and the community themselves that are recovering from the incident. And it's been estimated that this cost of the injury events each year is $9.6 billion. So a huge financial burden alongside this personal pain that's resulting from the injuries in our community. But fortunately, as a sector, we know that the majority of these injury events are predictable and preventable. And by taking the public health approach to injury prevention, that is one framework that we can use to help structure the activities that we are delivering to help prevent these injuries from occurring. And as you can see on the slide here, the approach consists of 5 really core strategies or key stages that we can go through to implementing our activities. And today we're going to be focusing on the very last stage there on the right hand side, that being evaluation. And I guess right from the start, I'll just highlight that although evaluation is, I guess, pictorially displayed at the far right end of this guide as the last stage, I guess, of the steps that we go through in our activities, it's really integral that we do integrate our evaluation activities throughout the whole course of our program planning and implementation. So we'll be chatting about that as well this afternoon. So what exactly are we going to cover? We're going to start off by chatting about what is the role of evaluation and how is it important to the work that we do in our injury prevention organisations and in our roles in particular. What are the different types of evaluation that we may be conducting to help support the activities that we are delivering? We're going to talk through how we can develop an effective and purpose-driven evaluation framework. And then finally, we'll chat through some different examples of project outcome, impact, and process level objectives. So hopefully, no matter if your experience is really vast in terms of implementing evaluation activities within your work, or if this concept is new to you, hopefully you'll be able to get something out of today, because we really just want to, as the title suggests, just set the scene in terms of what evaluation framework should look like, and then how you can integrate it into your work. And then next week we'll deep dive into the activities themselves and how we can apply some of these concepts in more of a tangible way in our work. So if you're inclined, or if you're able, please feel free to use the chat throughout today just to pop in any questions or any discussion points that might come to mind during it, because I know evaluation means different things to everybody, and you've all joined for some reason today, whether it's you don't know anything about it or you're particularly interested or have a strong skill set in a certain type of evaluation, but potentially not another. So it can mean different things to different people, and as a sector, our roles are so vast. So I'm sure there are people that might do this on a weekly basis, where other people it might be quite cyclical. I know we have a lot of CRCs and local governments online this afternoon that might just do it seasonally when different projects arise. So definitely means different things to different people. But from an academic perspective, evaluation is defined as a process by which we judge the worth of something, or also the systematic collection and analysis of data about processes, outputs, and outcomes to allow us to make statements, judgments, claims, and conclusions which have the potential to impact on current and future decision making. So we can already start to see there's lots of different layers that go into appropriate evaluation activities. That's why it's essential that we have this coordinated effort to our activities. Within evaluation, as you can see here through these boxes, there's a couple of core foundational elements that we do in our everyday practice. So even if we aren't aware that we're being evaluative, we are in our day-to-day lives. So even if you don't lead your organisations or your project teams' activities, it's still important that we're all aware of it, because we all have a role to play in evaluating our injury prevention activities. So when we are doing evaluation, it involves the formal and systematic process collecting and analysing data, making evaluative judgments as we go throughout our project, identifying findings and recommendations, and obviously reporting and communicating these findings either internally or externally as well is really important. So when we're talking about being evaluative, I guess it's just about being reflective in our work, using critical thinking and really being learning focused, which I think is what we do as a sector already, but really pushing this to the next level to make sure we are innovative in the work that we are doing. And just another little bit of terminology before we keep going. Often research and evaluation are thrown around in the same concept, and that's because they do have a lot of similar traits, but it is important that we do distinguish the two from each other, because today we are here just to talk about evaluation as a key part of the work that we are doing. So when we are evaluating, we are conducting it to assess the effectiveness and the efficacy of a specific intervention, whether that be a program, a policy, an activity, whether it is within our remit of work. There is no intention for us to generalize these findings to that of the overall community, or potentially in a different context or within a different demographic group. Whereas research, when we are conducting research, it's conducted within a particular sample with the hope that we can generalize these findings to a more broader population. So from a foundational perspective, yes, evaluation does have some similar concepts, but evaluation, we want to know if and how the activity in focus has worked, where research is more, I guess, theory driven and focuses on the why something might have worked. And again, it's important that we distinguish evaluation from monitoring activities. So when we're talking about monitoring activities, that's when we focus on the ongoing collection of information, mainly regarding the activities we might be delivering or the outputs that we have for the sector. But it's ultimately to support the management of the project that we are conducting as a team. When we are evaluating our activities, it's about gathering the information less frequently or more targeted perhaps, so we can be more analytical of these results to determine the program's merit at the end of the day. So why do we evaluate? I guess as a sector, the injury prevention and community safety landscape, our evidence bank is still growing. So therefore, by us evaluating even really small scale community projects, it's hugely valuable to us being able to continue to grow and to guide our future work and best allocate the resources that we do have available to us. So when we are evaluating our project, it helps us to identify if the intervention was implemented as planned, perhaps things deviated along the way, either unintentionally or intentionally, whether the program, the strategy, or the policy that we're implementing did have the desired outcomes or objectives that we set at the start of the planning phase. What were the outcomes of this intervention? If the intervention is doing any harm, obviously we want to make sure we're aware of that and mitigate any of those along the way as well. What is the return on investment that we've made? What resourcing have we invested into this project, and what are the rewards from that, which relies then on the impact of the work and obviously the effectiveness of the initiative. We want to be able to put out the best product that we can for the community. And again, by evaluating our projects, it really enables us to engage in that continual reflection and improvement part of the project. That's really important. Make sure we're ethically responsible in what we're delivering. We want to improve our personal understanding, but also the sector's understanding of the issue that we're trying to address. We might want to be informing policy and practice or help people to be able to replicate our work if it was effective. It's also integral to securing funding, as we're all aware, in terms of making sure that we are honest with that feedback that we do give in terms of demonstrating the worth of the project that we've rolled out. And ultimately, we're all working towards improving the outcomes of the community. So by evaluating our activities, it's helping us to do that along the way as well. And hopefully all these things, I guess you agree with them because you've joined today's webinar, and all these things are really positive. But of course, there are some challenges that we do face in terms of effectively delivering our evaluation activities. So some common things might be limited resourcing. So you might be juggling up the different personnel that you have available, the time that it does take, because doing evaluation effectively does take an investment of time. And you might also have limited budget to allocate to your resourcing, to your evaluation activities. So you're juggling those resources that you do have available. You might be experiencing some gaps in technical skills to collect and analyze your data. So hopefully today and next week's webinar will give you some insight into how you can strengthen some of those skills. You might have some challenges around accessing data, whether that be outcome level data or data collection tools to help you to facilitate your evaluation activities. So for example, you might be conducting a project that's ultimate outcome might be to reduce the incidence of crime or violence in Western Australia amongst a certain cohort, but you might not have access to that data set. So that might provide a barrier for you in terms of assessing its direct alignment to that outcome level goal that you set for your project. Other common barriers are around demonstrating the initiative's true impact. So we're going to talk through how we can best make sure that what we're evaluating and the tools that we're using best reflect the initiatives that we have rolled out. And there might also be an inability for you to transfer the results that you found to more so policy and practice level change to have that overarching impact on the community. But despite these challenges, fortunately, there are things we can do to overcome them and to make sure that we are effectively evaluating our project. So how we evaluate does really depend on what we're evaluating. So what program we're rolling out, the context that we're rolling it out, the population that's in focus that we're trying to work with, and what funding we do have available. So it's driven by all of these things. So there is no perfect solution because everyone joining today has come from a different background and is going to be rolling out a different initiative in the community. But most closely, when we are doing our evaluation, we need to make sure it's guided by the specific intervention's aims and objectives. So that's what we're going to focus on as well today, is how we can make sure our aims and objectives are structured in a way that supports our evaluation activities. So when do we evaluate? Evaluation related activities really should be occurring during every phase of our project, just different types of activities along the way perhaps, and within each phase that we are conducting. So what you can see on your slide here is what would be considered, I guess, a standard approach to evaluating an injury prevention project. So you might start off with some planning activities, and during the planning phase of your project, it's important that we conduct some formative evaluation activities. So maybe a needs assessment or a literature review to make sure that what we are thinking is more evidence-based, is the evidence-based activity that we should be rolling out in the community. Then just before we roll out the initiative, we might choose to conduct a pre-activity measurement. So a pre-survey, for example, regarding the target audience baseline knowledge or behaviours towards the topic in focus before we then roll on to rolling out the initiative during that implementation phase in the middle there that you can see. During this phase, of course, we'll collect some process level data to make sure that we are collecting some of those what would be considered monitoring activities, so counting the activities that we're doing. And then we might distribute a post survey directly after the initiative before moving on to outcome level evaluation activities. So on the far right there, we might conduct some additional outcome assessments, in particularly following up on people who've engaged in the activity. Because I mentioned at the start, we must start planning our evaluation activities when we are designing our projects. There's a few things that's really important that we consider right from the start. Firstly, what are the requirements for our funders? So making sure that we're collecting that evidence to make sure we can report back to our funding body at certain points throughout the project or at the end if that's all that's needed. What expertise do we have within the team? So making sure we're pulling on the skill sets that are available to you, whether internally or the connections that you have within the larger project team. What funds are available for us to use. So ideally, we want to be allocating about 10% of our program budget to evaluation activities just to give it that justice that it deserves in demonstrating its success. What are the goals, objectives, and strategies of the project that we are doing? And also who require access to these results when they are available. So that, again, making sure that we do have that data available to them, to everyone that requires it at the end of the day. So today we're going to discuss four main types of evaluation, those being formative, process, impact, and outcome evaluation activities. And as I just mentioned, formative evaluation mainly occurs during the planning phase of a project because it helps us to inform how the interventions could best be implemented. By conducting things like a needs assessment or stakeholder consultations and literature reviews, it can help us to identify if the project's goals and objectives that we've set are realistic. And it assesses us in testing, I guess, if the tools or the intervention that we're going to be rolling out is appropriate to the target audience that we're trying to influence. If your project does involve, I guess, a new topic or something perhaps that your team is less experienced in delivering or a new scope of practice for your organisation, it will often involve more formative evaluative activities than an initiative that you might have been rolling out for a number of years now. But that's not to say that if you are rolling out an ongoing initiative, there is no place for formative evaluation because the evidence bank is always expanding. So we need to make sure that we're still conducting those formative evaluation activities. The second stage is process evaluation. So those are the activities that we conduct whilst we're implementing our project. So this could be keeping track of the outputs that we're delivering. So maybe around their quality or the acceptance of those activities, or what's the engagement been in the project, how's our budget tracking. All of these types of evaluation is generally what most people are most confident in collecting because it's a core part of that project management side of things. So these might be things like counting the number of sessions that we delivered or the number of attendees that are attended our activity, or doing a post activity survey to gain insight into what participants thought of the activity that they engaged in or what their future intentions are after engaging. So I'm sure a lot of you are already conducting a number of these things, but it's still important that we're conducting them in the best way possible as well. Impact evaluation, I guess by nature, is about measuring the impact of the initiative that we're rolling out. And as we'll discuss in a minute, what we measure is really based off our project's aims and objectives. But in most cases, we're wanting to assess if our target audience has experienced changes in their awareness, their knowledge, their attitudes, or their intention towards the topic in focus. For some projects, we might also be, I guess, aiming or seeking to influence different policy or different practices happening regarding the injury topic in focus. So therefore, we might want to measure this form of change as well within our work. This is commonly, I guess, collected through post surveys or follow-up surveys or interviews or focus groups with people who have engaged with the project. But it's important that we note that the type of change that we're aiming for really needs to influence when we are conducting these impact evaluation activities. So if it's only a small scale project that we're expecting people to do immediate behaviour change with, it's okay if we follow them up a couple of weeks after the initiative. But if we're the kind of change that we're aiming for is going to take significant contextual change, we want to allow some months to pass before we conduct some of our evaluation activities to ensure there's enough time has passed for the potential change to have occurred. And finally, of course, is outcome evaluation. So this data collection links the outputs of our project with the outcomes by focusing on, I guess, the extent of change that has occurred during this period of time. As a sector and as people who are passionate about keeping our community safe, ultimately we are all aiming to and hoping to achieve this level of outcome change in the community. But in most cases, it's going to require that collective effort towards our injury prevention activities to achieve these desired outcomes. Because when we're talking about outcome evaluation, it might include measures regarding the rate of injury hospitalisations or the number of people that are conducting the desired protective factor, for example, to work towards these levels, reduce the levels of hospitalisations and fatalities in our community. And that's not going to be achieved through one intervention that we're delivering as an organisation. It's going to require all of us to work together towards these outcome level changes. So just a quick overview here, I guess, to give some context to some of these different activities in terms of what we do at Injury Matters. So this is an example of just some of the evaluation activities that we conduct as part of our Stay on Your Feet program. And so as you can see, our formative work, we really want to understand the topic that is falls and falls prevention and potentially the relevance of the proposed interventions that we do have. So we might conduct an evidence review to identify some key pieces of literature regarding these initiatives. Whenever we roll out a new initiative, we always consult with our target audience. So do a needs assessment and pilot test our resourcing to make sure that it is appropriate and accepted by the target audience. Process evaluation, like I'm sure what lots of you do, we do track our attendance at things. So whether we attend an event or a training or facilitate a networking event, making sure we're recording some of that process level data. We do post activity surveys to measure some of our key objectives. So please do make sure you do the survey at the end of today's webinar. And we also track the resourcing that we do distribute into the community. And complementing some of these process level activities, we do impact evaluation every 2 years. So surveys, interviews and case studies with individuals who've engaged in the program to help us measure those impact level changes that might not have been experienced or collected during the process evaluation activities. And finally, the program does aim to reduce the impact of falls in the community. So this is measured by the WA Department of Health in terms of the falls related hospitalisations and fatalities across the state. And I'm sure every single person is going to have a different weighting across these 4 different types of evaluation, but no matter what project you are rolling out, you will touch on these 4 concepts. And this pictorial on the slide at the moment is taken from the WA Department of Health's Evaluation Framework and Implementation Guide. So if you do receive funding from the Chronic Disease Prevention Directorate, you would be familiar with this resource as it provides guidance on the reporting requirements for contracted programs. But if you're not funded by the Directorate, the resource still provides a really great framework to model your evaluation activities off. And just to give you a quick overview, I guess, as you can see on the outer rim there are 5 key phases that it's suggested that we go through to guide our program's activities. So those being program planning, research and evaluation planning, implementation, review, and quality improvement. And within each of these phases, it highlights the key activities to be conducted just to reinforce how evaluation is integrated into each phase and across the lifespan of our project. So it's important that we don't miss any of these steps. And on the very, very outside there, you can see those 4 key types of evaluation that we've just spoken about in terms of where the majority of their data collection might occur in your project's lifespan. And within the framework, it does highlight a significant focus on program planning just to really help inform the project's aims, objectives, and activities to make sure that they are considered before we do jump into the more exciting stage, I guess, of rolling out the initiative itself. So When you are conducting your program planning activities, it's important that we consider how the program that we're rolling out, or the initiative, whatever terminology we want to use, how that links to different national, state and local priorities. So it gives us an opportunity to consider how our program might be contributing to different, more, I guess, societal activities and areas of focus across the state. So for example, maybe you're rolling out an initiative targeting mental health in young people in Western Australia. You might realise this aligns to the National Preventive Health Strategy and maybe the WA Health Promotion Strategy, and perhaps your local government's public health plan also has significant focus on improving youth mental health. So it helps us to provide that context before we jump into the initiative itself. And after assessing the capacity, as we touched on in terms of what's needed to implement the program, we want to make sure that we have clear program aims, objectives, and activities. So if your program or the initiative that you're thinking about developing does not have one, you might find it helpful to complete a program planning logic model before you progress to considering your evaluation needs, because this will really assist you in developing those evaluation activities. So the three pillars within the model are the program's aims, the objectives, and the activities, because they're going to help to design the different evaluation activities that you conduct. We do, as we all know, we need to make sure that these aims and objectives are measurable so that we can evaluate them. So in order to do this, it's important that we do follow the SMART approach, which again, I'm sure we've all come across, but it's important that we do take the time to reflect on it, because it's helpful that when we're when we're writing our measurable objectives, we're making sure we're ticking all these boxes. So we want to make sure that it's specific. So is it clearly identifiable what we want to achieve through this initiative? Is it measurable? So are we able to easily access the type of data that we want to make it measurable at the end of the day? Is it achievable? So are we going to be able to achieve what we've set out with the resourcing that we do have available? Because we don't want to dig a hole for ourselves right from the word go. Is it realistic or relevant? So making sure that our objectives relate to the activities and align to the aim that we've set ourselves from the initiative. And is it time specific? So we always need to include a time frame, again, to help inform when we are conducting those evaluation activities. When drafting up the objectives, it's also important that we consider like, who are the people that we're trying to reach through our initiative? What action or change are we seeking from them? When should we expect to see that change or get that change to occur? Where are the target audience located, and how much change are we realistically expecting from this project? Because if we don't consider these 5 things, it's going to make our objectives and the measurement of them less optimal than they could be. It's important that our objectives also include reference to the factors that might contribute to the injury topic that we're working to address. So our objectives can cover a whole range of different elements. So whether that be the risk factors that we're working to address, the protective factors, the target audiences, knowledge, attitudes, etc., towards the injury topic in focus, or policy level change as well, as we spoke about, or potentially the community's involvement in the initiative as well is really important to consider. So there's a whole range of factors that are potentially possible to include in your objectives, depending on what the scope of your project is. So once you do have all this sorted and all of your elements of your project planning are complete, it's only then that we can turn our focus to evaluation. So if you're at the stage of your program planning where you're not able to articulate those things just yet, we need to make sure that we have them solidified before we move on to planning out evaluation activities. So in terms of those planning activities, developing an evaluation plan is really helpful for this. So this will allow us to guide what occurs before we roll out our initiative, during the initiative, and also while we're rolling out the initiative, to make sure we're not missing any opportunities for data collection along the way. So key to this is developing outcome, impact, and process level indicators that these directly align to those predetermined aimed objectives and activities that we've just discussed. So As you can see on the table here, each indicator is listed alongside its aim, objective, and activity, just to really provide that clarity on what exactly we're going to measure and to make sure that the whole project team is across and in agreement that this is what we're working towards. So once we've highlighted those three indicators, we can then move across the columns to look at, okay, how are we going to collect this data that we need? So we're going to do some surveys. Are we going to do an interview with different people that engage in the project? When the data is going to be collected is also really important, and also who's responsible for collecting the data. So making sure that we're all really clear when and who this information is going to be collected by. It doesn't matter, I guess, what the duration of your project is, how long it's been running for in the past, what your funding requirements are. All projects, no matter their scale, would benefit from an evaluation plan. So if you don't already have one, or if you're halfway through a program, for example, there is still extremely valuable that you sit down and take the time to conduct an evaluation plan for each project that you are delivering. I am conscious of time, but this is just a quick example here of what a potentially a real life evaluation plan could look like. So completely hypothetical, if we worked for the City of Greater Geraldton and we received funding regarding some e-scooter safety, which is extremely topical at the moment, and we might be going out in the community and doing some education sessions with youth in the local high school to change their behaviours and awareness of the issue that is e-scooter safety. We want to make sure we're turning the different aims and objectives that we have into tangible indicators that we can measure. So from an outcome perspective, we might want to look at the number of hospitalisations that are presenting to the main two hospitals there in Geraldton, and then at what frequency do we want to look at this data. So maybe every 6 months we might look at hospital records to see if there's been any immediate change in those hospital presentations, for example. And then from an impact perspective, because it is focusing on building the knowledge of the residents, we might do different workshops with the youth in the area. So in order to measure these specific activities, we'll do pre and post measures before and after the workshops, just to gain insight into what people's perceptions are and their awareness and knowledge that they've gained from the workshops themselves. Of course, these are just two example impact indicators on your slide at the moment, but this would be part of a whole suite of indicators that's reflective of the whole initiative that we are rolling out in the community. And likewise for our process level indicators, these would just be a sample of some of the activities that we would do to collect those process level indicators. So how many workshops did we actually deliver? How many people attended the workshops? How many signs did we install? So maybe we did some physical installations around safety, e-scooter safety in different locations throughout the city. And maybe we also conducted a social media campaign. So making sure that we have different indicators that align directly to each of these activities to demonstrate their impact on an individual activity level as well is really crucial. When we are considering, I guess, okay, we know what we want to measure, we need to start to think about how can we collect this type of information. We might need to collect some quantitative and also some qualitative data. So quantitative data is really helpful for us to gather lots of information from lots of people, and it's fairly low resourcing required. But the downside to quantitative data is that it might not provide the level of depth that we need to really unpack the issue in focus. So that's because it mainly centers on close-ended questions that have predetermined response rates. So those multiple choice questions that we commonly respond to in surveys. Um, and these could be things regarding, I guess, counting the number of activities that we did, or conducting a survey or an audit would provide great quantitative data, but we need to make sure that this is complemented by qualitative data to make sure we still have that storytelling element of the work that we are doing. Because qualitative data does focus on those open-ended questions, it does enable us to collect some of these respondent responses a bit more organically, provides them all that dynamic information from participants, whether that be through interviews or focus groups or even some observations you might be able to do out in the community, just to really help to triangulate the data that we do have available and potentially to reject some findings that you might have had from different sources of your evaluation plan. And qualitative data has definitely grown in popularity of late, particularly through the use of case studies and things like that to provide that human element to the work that we're doing. So even if you are rolling out a smaller scale initiative, you might find that those kind of measures are really valuable in truly demonstrating the impact that it has had on your local community in particular. Um, Before we wrap up, I also just want to highlight some ethical considerations. So the NHMRC does have some guidelines out regarding, guidelines to help us conduct ethical evaluation and research activities. I know I said at the start the research is different from evaluation, but ultimately the core concepts and the values that the guide highlights reinforces that we do have a responsibility when we're conducting our evaluation activities to make sure that we are conducting it with the best intentions possible. So within this, it's making sure that there is merit and integrity in what we're doing. There is justice in the work that we're doing. So making sure our recruitment, for example, is fair, that participants are not exploited in the work that they're doing. Beneficence primarily refers to the need for the likely benefits to outweigh the potential risk. And I guess within our scope of work, no harm is the goal. So this is less of an importance, but it's still important that we are considering this. And finally, respect, hopefully the most obvious one of the lot. This refers to having, I guess, regard for the welfare of the people that we're working with in the community through the initiative. Also, when we're doing our evaluation, it's important that we do provide participants with all the information that they may need to decide if they wish to opt into our evaluation activities, and also to document this consent once they have provided it to us. And there's some really good templates in terms of these information sheets and disclosures that you might wish to make prior to doing your evaluation activities in some of the resources I'll put on the slide in a minute as well. So I definitely encourage you to check those out. So that's a lot in half an hour, but that was the idea. We hope just to give you an insight into, I know some of you really experienced in your evaluation work, so just thank you for taking the time to sit down and give it dedicated time and energy, I guess, to a bit of a refresher in terms of making sure we're being as rigorous as possible in our evaluation activities, and hopefully for some of you, giving you some insight into some of those frameworks that you might wish to follow moving forward with your evaluation. So some key recommendations, I guess, to reinforce are making sure we're planning from the start. So by conducting our evaluation activities right from the formative stage, it sets us up for success when we go towards the end of our initiative. As we spoke about, the evaluation framework itself is really vital to providing this framework for the whole team to buy into, and that accountability to make sure we are measuring what we've committed to throughout the duration of our program. Using questions that already exist, we'll touch on this a lot more next week, but validated tools are really key. So when you are developing your evaluation plan, don't feel like you have to start from the start every time. There are so many tools out there for us to work off. Fourthly, there, only ask questions that you intend to use. Everyone is so time poor these days, so there's no need to place extra burden on your participants or yourself by collecting more data than you need or intend on using at the end of the day. And finally, I guess relating to that is it's very easy to overcommit to a resource intensive evaluation plan. So making sure we're practical about what we can commit to with the resources that we do have available. We do have some questions. So we have a question here around what is the difference between an evaluation framework and evaluation plan? Great question. We operate in a similar framework across both. So we only do an evaluation plan. We won't do a framework and a plan as an organisation for the projects that we conduct, because we want to make sure that the activities or the intentions that we do have are complemented with the actual delivery of it. So as I mentioned, we don't want to set high hopes in terms of what we're going to do from a framework perspective and then put out these nice to haves. We want to make it tangible by developing the plan itself. So an evaluation framework might be some high level inspirational objectives that you might be working towards, but then they will then have to be transferred into a plan itself. So making sure that you can integrate both your objectives and your plan into one, using the model that we discussed to make sure it's tangible in terms of what we're doing. Otherwise, there is no accountability in terms of measuring all those different objectives that you might have set in your framework. So the plan itself is really key in terms of having one central document that outlines and gives the whole project team an idea of, okay, what are we working towards? What's our program aim? And therefore, how can we correlate these to different evaluation tools to make sure that we're collecting everything that we need along the way as well. But yeah, there's lots of different terminology used, I guess, in the evaluation space like anywhere else. So yeah, they can be considered one and the same in some instances, whereas other people want to separate the two to make it more of a tangible working document for the team versus a guide in terms of what we might be doing as an organization or a project team. Cool. It doesn't look to be any more questions, but please do reach out if you do have any questions. The team is always here and able to offer assistance to help increase your capacity to effectively evaluate the initiatives that you are rolling out in the community. Or if you think of anything between now and next week, there'll definitely still be time for that again next week. So yeah, that's all for us. Thank you for taking time out of your lunch breaks to join us today. Next week's session will also be 45 minutes. So please do continue to join us again next week. But in the meantime, have a great week and feel free to jump onto the website to have a look at some of those tools that we spoke about as well. Thanks, everyone.